Is your healthcare system a single-sided salad bar or a double-sided salad bar? Ever notice when you walk up to a salad bar that sometimes it's hard to get to the ingredients in the way back? That's usually where they keep the most expensive stuff like meat and cheese. The cheaper items, greens, veggies, oil and vinegar, they're usually at the front, much easier to reach. It's easy to see that this design allows restaurants to reduce costs by making it harder for customers to grab and eat the pricier choices. Entirely rational, if a little sneaky. The single-sided salad bar is a really good analogy for how health systems in places like Canada or the United Kingdom control costs too. Those single-payer healthcare systems tend to put gatekeepers in front of a lot of care. Bacon, neurosurgery, same thing. In Canada and the UK, patients can see their primary care providers, get employee assistance program type mental health visits, get generic drugs and vaccines very easily. Advanced imaging like MRIs and CT scans, specialists like an OBGYN, or brand name drugs are much tougher to reach, and you need a referral from your primary care physician. In the way back, where you would find bacon, turkey, and cheese on a salad bar, you have your neurosurgery, orthopedic surgery, and hospital stays. Not only are these harder to reach, since care is limited by strict cost controls, you can wait a pretty long time for many procedures, much longer than we wait here in the United States. Meanwhile, care in the UK is funded by a 20% sales tax on every transaction. It's free to go to the doctor, but you have to register with a PCP who will control all your healthcare decisions, including referrals to specialty care. PCPs are employed by the government health districts, and they must answer to both their patients and their employers. Even the US has a single-sided salad bar for healthcare. If you're in the Medicaid program, you'll find care is rationed accidentally. Want to see a specialist or an orthopedic surgeon? Good luck finding one with an opening. The rates that Medicaid pays to docs and hospitals are so low that many are not willing to take new patients, creating a lot of demand for very few providers. Do you have private insurance or Medicare? Congratulations, you're eating from the double-sided salad bar. Need an orthopedist, an OBGYN, or specialty care? You're one of 200 million Americans who typically will not need a referral and usually have your pick of providers and appointments. You can reach pretty much any ingredient you want. Are you ready to give up your double-sided healthcare salad bar? There's a lot of talk about creating a new healthcare choice for Americans. Some advocates are promising you access to the double-sided salad bar you already have, but for the price of a single-sided one. Regardless of what it's called, single-payer, Medicare-for-All, universal health care, it's all a government-run and managed system. And you know what they say, if it sounds too good to be true, it probably is. The straight talk is, the single-sided salad bar for Americans would prove to be too costly, with long lines to reach the good stuff in the middle and the back rows. Are you ready to wait in line for your health care?